If your spouse is sitting in the living room right now and they suddenly stare at the television remote like it's an alien object they've never seen before, what would you do? Most people would ask if they're feeling okay. Most people would suggest they lie down and get some rest. And that well-meaning suggestion, that simple instinct to comfort them, is exactly what turns a highly treatable medical event into a permanent tragedy. I'm Dr. Marcus Vance, and in my years working in neurology and emergency medicine, I have seen thousands of stroke patients roll through the ER doors. What I'm about to share with you today isn't about eating more broccoli, lowering your stress, or doing morning stretches. This is about the acute, terrifying first 3 minutes of a suspected stroke. In the next few minutes, I am going to show you the exact sequence of actions that emergency room doctors desperately need you to take, the fatal mistakes that well-meaning families make every single day, and how you can hand the hospital the exact information they need to save your loved one's brain. But before we get into the protocol, I need to ask you an honest question. How many of you have ever felt a strange, sudden symptom, maybe a flash of dizziness, a numb thumb, or a moment of deep confusion, and decided to just tough it out because you didn't want to make a fuss or bother your family? Tell me your age, and if you've done this in the comments below, because that exact mindset is the first enemy we need to defeat today. Let me tell you about Arthur. Arthur was a 71-year-old retired machinist living in Columbus, Ohio, a guy who worked with his hands his whole life. He was sharp, independent, and deeply proud. One Tuesday evening, Arthur was sitting in his favorite recliner trying to change the channel on the TV. His wife, Helen, noticed he was just staring at the remote, turning it over and over in his palms. When she asked him what was wrong, he tried to say, "The buttons," but the words came out as a jumbled, slurred mess. Arthur immediately waved her off. He pointed to his head, shook it, and managed to mumble that he was just tired. He wanted to go sleep it off. He didn't want an ambulance at the house. He didn't want the neighbors looking out their windows. He didn't want to be a bother. He just wanted to rest. Helen had a choice to make in that exact moment. Listen to her husband of 40 years and let him sleep, or make the fuss he was begging her not to make. She chose to make the fuss. And because she did, Arthur is still walking, talking, and living independently today. To understand why Helen's choice was a matter of life and death, you have to understand what a stroke actually is beneath the surface. Most people imagine a stroke as a sudden dramatic collapse. Lights out. Game over. But that's rarely how it begins. Think of your brain's blood supply like the electrical wiring in a house. Every thought you have, every word you speak, every movement you make is powered by a continuous flow of blood carrying oxygen to specific rooms in that house. Now, imagine a blood clot forms and blocks the main wire to the living room. The lights go out. Sometimes, that clot is temporary. It blocks the blood flow for just a few moments and then breaks apart or moves. The lights flicker, go dark, and then come back on. In medicine, we call this a transient ischemic attack, or a TIA. You might have heard it called a mini-stroke, but mini is a dangerously misleading word. A TIA is not a minor event. It is your brain's emergency alarm system screaming that a catastrophic, permanent blockage is just moments or hours away. The problem is, when those symptoms vanish, when Arthur's speech suddenly clears up 5 minutes later, or when that numb arm feels perfectly fine again, people breathe a massive sigh of relief. They tell themselves they dodged a bullet. They think the danger has passed. It hasn't passed. When those symptoms disappear, it doesn't mean you are safe. It means the clock has started ticking. This brings us to the greatest danger facing adults over 55 today. It isn't just high blood pressure or high cholesterol. It is stoicism. It is the generational habit of endurance. Many older adults grew up in a time where you didn't ask for help unless you were absolutely desperate. You didn't complain. You didn't want to be a burden on your children, and you certainly didn't want to cause a false alarm that would bring a wailing ambulance to your front door for the whole street to see. So, when a symptom hits, when your face droops for 30 seconds, or your right leg gives out for a moment, you tell yourself it was just fatigue. You tell yourself you stood up too fast. You try to wait it out. But when it comes to the brain, waiting it out is fatal. Brain cells do not regenerate the way a scraped knee heals. When brain tissue is starved of oxygen, millions of neurons die every single minute. The difference between calling 911 immediately and waiting to see how you feel in an hour is the difference between walking out of the hospital 2 days later and spending the rest of your life in a nursing care facility, unable to speak. Arthur's hesitation wasn't unusual, it was standard. He felt vulnerable, and his instinct was to hide it. Helen overriding that instinct is what saved his brain. But recognizing the symptom and overriding the stoicism is only step one. What happens in the next 3 minutes, before the paramedics even pull out of their station, dictates whether the emergency room doctors can actually use our most powerful weapons to save you. And if you make the one fatal mistake that thousands of families make every year out of pure love, our hands are completely tied. That fatal mistake I just mentioned? It usually starts in the medicine cabinet, and it is driven by one of the most widely misunderstood pieces of medical advice in history. For decades, we've been taught that if someone is having a heart attack, you should immediately give them an aspirin to chew. It's excellent advice for a heart attack. But a stroke is not a heart attack, and treating it like one is a gamble you cannot afford to take. Let me tell you about Diane, a 68-year-old retired teacher from Scottsdale, Arizona. One Sunday morning, her husband collapsed onto the kitchen counter. His left arm was completely weak, and the left side of his mouth was drooping. Diane recognized it was a stroke. She was terrified, but she wanted to help immediately while waiting for the paramedics. She remembered that aspirin thins the blood and breaks up clots. So, she grabbed a full-strength aspirin, put it in his mouth, and gave him a glass of water to wash it down. Diane acted out of pure, frantic love. But in doing so, she unwittingly created two massive, potentially lethal complications. Here is what you need to understand. There are two main types of strokes. The first is an ischemic stroke, where a blood clot blocks an artery in the brain. The second is a hemorrhagic stroke, where a weakened blood vessel in the brain literally bursts and bleeds into the surrounding tissue. From the outside, sitting in your kitchen or living room, these two strokes look exactly the same. Even I cannot tell the difference just by looking at a patient. The only way to know is to put the patient inside a CT scanner at the hospital. If your loved one is having a bleeding stroke, their brain is actively hemorrhaging. If you give them an aspirin, a powerful blood thinner, you are essentially pouring gasoline onto a fire. You strip away the body's natural ability to clot and stop that internal bleeding, turning a survivable bleed into a catastrophic one. And then there is the glass of water Diane gave her husband. During a stroke, the neurological signals that control the complex muscles in your throat often shut down. The patient loses their gag reflex and the ability to swallow safely. When you pour water or a pill into their mouth, it doesn't go to the stomach. It goes straight down their windpipe and into their lungs, causing choking, oxygen deprivation, and later, severe aspiration pneumonia. So, let me ask you right now, did you know about the aspirin trap, or would your very first instinct have been to rush to the medicine cabinet? Let me know in the comments, because if you thought an aspirin was the right move, you are absolutely not alone. But now, you know exactly what not to do. No aspirin, no water. This kun archi intaker. No food. Yes, sir, and nothing goes in the mouth. Period. Instead, your entire focus must shift to being the ultimate observer and the ultimate timekeeper. In neurology, we use a very specific framework. You've likely heard it before, but I want you to hear it today with the weight of an emergency room doctor behind it. It's called the FACE-T test. Yakin F stands for face. Ask them to smile. Does one side of the face droop? Is the smile uneven? Just A stands for arms. Then insert bolwat. Ask them to raise both arms out in front of them. Does one arm drift downward? Can they even lift it? Stands for speech. Gatsen sir and cross chintir yurting tur. Ask them to repeat a simple sentence, like the sky is blue. Are the words slurred? Are they speaking nonsense, or are they unable to speak at all? If you see even one of these signs, you have reached the final and most critical letter. Stands for time, and time means calling 911 immediately. Please, hear me on this. Do not put them in your car and drive them to the emergency room yourself. I know the instinct is to just go, thinking it will be faster. But when you call 911, the ambulance doesn't just act as a taxi. Those paramedics are trained to start stabilizing the patient immediately. More importantly, they call ahead to the hospital. They trigger what we call a stroke code. When a stroke code is activated from the road, we literally clear the path. The CT scanner is emptied and waiting. The neurology team is standing by the doors. The lab is prepped. If you drive them yourself, you walk in through the front doors, take a number, and sit in the triage waiting room while brain cells die. Call 911. but calling 911 is only half of your job. The other half is what actually unlocks the miracle of modern stroke medicine. When you arrive at the hospital, my very first question to you isn't going to be about their diet, or their cholesterol, or their family history. My very first question is going to be, what is their last known normal? This is the golden window. We have a powerful standard of care drug called TPA, a tissue plasminogen activator. It is a literal clot buster. When administered in time, it can dissolve the clot, restore blood flow, and literally reverse the stroke. Patients who were paralyzed on one side have been known to walk out of the hospital days later because of this drug. But TPA comes with a very strict, unforgiving biological countdown. We can typically only give this drug within a 3 to 4.5 hour window from the exact moment the symptoms started. If you give TPA after that window closes, the risk of causing a fatal brain bleed becomes too high, and we are legally and medically forbidden from administering it. I want to introduce you to Sarah, a daughter living in upstate New York. She was having morning coffee with her mother when her mother suddenly dropped her mug and her speech slurred. Sarah didn't panic. She didn't ask her mother to sleep it off. She grabbed her phone to call 911 and she looked at the clock on the microwave. It read exactly 10:14 a.m. When Sarah arrived at the ER, she didn't say, "It happened a little while ago," or "sometime this morning." She walked up to the attending physician and said her last known normal was exactly 10:14 a.m. That one sentence, that precise timestamp, was the golden ticket. It took the guesswork entirely out of the equation. It gave the medical team the absolute confidence to rush her mother to the CT scanner, confirm it was a clot, and administer the TPA well within the safety window. Sarah's mother regained full use of her arm and her speech. If Sarah had said, "I'm not sure, maybe around breakfast," the doctors might have had to withhold the drug, fearing the window had already closed. Your job in the living room is not to be the doctor. Your job is to be the timekeeper. Look at your watch. Look at your phone. Write the exact time down on a piece of paper, or write it on your hand if you have to. That number is the most valuable piece of information in the entire hospital. So let's bring all of this together into a single, unbreakable 3-minute protocol. I want you to memorize this, teach it to your spouse, and practice it in your mind so that if the moment ever comes, you don't have to think, you just have to act. Minute 1, the recognition. You see the flickering lights, a sudden facial droop, a weak arm, or garbled speech. You immediately run the FAST test. Face, arms, speech, time. Minute 2, the timestamp. Look at the clock immediately. Do not guess. Lock in the exact time their symptoms started, or the exact time they were last seen completely normal. Write it down. Minute 3, the handoff. Call 911 immediately. Do not put them in your car. Do not give them a glass of water to calm their nerves. And under absolutely no circumstances do you give them an aspirin. You keep them seated or lying down safely, and when those paramedics walk through the door, the very first words out of your mouth should be that exact timestamp. Let's go back to Arthur in Columbus, Ohio, the retired machinist who couldn't figure out his TV remote and just wanted to sleep it off. Helen, his wife, refused to listen to him. She didn't let him go to bed. Instead, she looked up at the grandfather clock in their hallway. It was 7:42 p.m. She picked up the phone and dialed 911. Because Helen made that call, the ambulance triggered a stroke code from the driveway. By the time they arrived at the ER doors, my colleagues were already waiting. Helen walked in and gave them the golden ticket. His last known normal was exactly 7:42 p.m. Because the medical team had that precise time, they knew they were safely inside the 3 to 4.5 hour window. Arthur was rushed to the CT scanner, an ischemic clot was identified, and the TPA clot-busting drug was administered immediately. 2 days later, Arthur walked out of that hospital on his own 2 feet. Today, he is back in his favorite recliner, holding that same TV remote, fully independent and sharp as a tack. If Helen had let him sleep, if she had yielded to his pride and waited to see how he felt in the morning, Arthur would have woken up with permanent, catastrophic brain damage, if he woke up at all. I want to speak directly to anyone watching this who prides themselves on being tough. I respect your resilience. I respect the generation that built this world by pushing through pain and not complaining. But your brain does not care how tough you are. Brain ischemia cannot be defeated by grit. When your brain is starved of oxygen, you cannot tough it out. In that moment, asking for help isn't a sign of weakness. It is the only biological option you have. And if you are the spouse, the child, or the caregiver sitting across the room, making a fuss is the greatest act of love you can possibly perform. You do not need to be a medical professional to save a life. You just need to be observant, you need to be fast, and you need to know what time it is. ER doctors like me are standing by 24 hours a day, 7 days a week, ready to deploy the most advanced medical technology in human history to protect your brain. But we cannot do our jobs unless you do yours first. Now, I want to hear from you. Comment golden window if you're going to memorize the time rule today. Comment no aspirin if that warning shocked you. Or comment sharing today if you are sending this to your family group chat right now. And I strongly encourage you to do exactly that. Send this video to your family group text right now. It takes 10 seconds, but it ensures everyone in your household knows the time of onset rule and the deadly do-nots. It equips your loved ones to act on pure instinct rather than panic. If this knowledge empowered you today, save this video so you can review it later, and subscribe to the channel for more evidence-based, emergency-tested advice on protecting your health and your independence. I'm Dr. Marcus Vance. Stay vigilant, stay prepared, and I will see you in the next video.